we are obviously seeing an increase in cases in our area and nationwide right now. This is something that is going to ebb and flow over time with COVID. Something that is a very good sign about where we are in the pandemic is that hospitalizations are remaining low. So that tells us that our vaccines are working, that the mitigation strategies that we put in place personally and for our families are working, and the antivirals that are available now for those 12 and older are also helping to keep people out of the hospital. All transparency, it took me a while to figure this out myself. I thought there was a bonus test in each box. So there are 2 tests per home kit box, because if you test negative initially, which can happen to quite a few of us if we're testing very early when we have symptoms or a known exposure, you want to give yourself a little bit of time and then retest. So the second test is for that retesting. It's really important if you have symptoms to retest within 24 to 48 hours. That will allow, if you test negative initially, to grow a little bit more in your system and prompt that test to show a positive result. Feeling symptoms, go ahead and test right away. There's a possibility you could test negative if you're early in your infectious period, if you do have COVID. But if you're not experiencing symptoms and you are a known exposure to somebody who has tested positive for COVID, to at least test within a 5-day window, just to make sure. If you have symptoms, again, test right away. Or if you develop symptoms, even if you don't initially have them, within that 5-day window. The symptoms are the key to trigger you to go ahead and test. If you were exposed, but you don't have symptoms, you have a little bit of a grace period, but no longer than 5 days. You want to go ahead and test yourself. We encourage everyone who tests positive on a home test to contact your medical professional, your primary care provider. Let them know that you're positive. Really, that's for you. That's so because your doctor knows you best. Your pediatrician knows your child best. So they can ask some questions, go over some information based on the symptoms that you may have or your child may have. Sometimes there's maybe some medications they want to prescribe for those 12 and older, some antivirals, which are really important, readily available now. Those antivirals can really help prevent serious illness, even in those of us who are fully vaccinated and boosted. So that's important. Also, maybe you have a cough or your child has a cough. The doctor can maybe offer some advice on some over-the-counter medications that are best for you or your child, because again, they know you best, or even sometimes maybe a prescription to help quell that cough or whatever symptoms you might have. The Rappahannock Area Health District does still offer free PCR testing twice a month, basically every other week. Right now, we've been holding events at Dixon Park in Fredericksburg. That may change from time to time based on particular needs that we recognize in different localities. We generally have about an hour and a half, 90-minute window on Thursdays. We've been holding these events. So we do have those. Want to make sure that everybody knows that every household in the United States is eligible for 8 free at-home COVID tests from the government. If you go to covidtest.gov, you can sign up for those free tests. If you did get the 4 free tests, make sure to get the 4 additional free tests that your household is eligible for. For children aged 12 and older, for anyone aged 12 and older, the Pfizer booster is available if you've had your vaccine, your primary vaccine series, at least 5 months ago. So I always recommend, if you're just not sure about timing, you don't feel quite comfortable with whether or not it's the right time, check with your doctor, check with your child's pediatrician. You should also have your vaccination card from your primary series, and those dates are available to you when that was completed on that card. If you have lost your card, you can go to vdh.gov, and there is a page available for you to access your vaccine records there. Mutations are going to continue to happen. That's expected with any virus, certainly with COVID-19. And the best way that we can protect ourselves from any new variants that come along is to be fully vaccinated and boosted when eligible. And for our children who aren't eligible to be vaccinated just yet, those under 5, make sure that everyone in the family and the household who is eligible is up to date on their vaccines, and up to date means being boosted as well. I think the easiest thing to do is the Rappahannock Area Health District's website. We actually have a widget at the very top of the homepage that allows you to type in any state, any city, county, any locality in the U.S. To pull up the transmission level for COVID-19 for that particular area. So whether it's here at home or you're traveling to a certain location, visiting family, your kids are going away to a camp, you can definitely check to see what the transmission level is in that particular area. Keep in mind that the CDC updates only weekly. So as of about 8 p.m. each Thursday evening, the new transmission levels will come out for that week, and they will remain in place until the following week. So, it's really just also, and it always has been, a matter of personal accountability and responsibility. If you feel more comfortable, regardless of a transmission level, wearing a mask, making sure you're social distancing, participating in activities that are outdoors as opposed to indoors, or all of the above for your children, do what makes you feel best, what makes you feel safest and most comfortable. We have a lot of different mitigation strategies that we have used over the past 2+ years. Pull any of those out of your back pocket to use to feel, like I said, comfortable.